As ADT activity is received, they're aggregated in Zeus transitions work list. For example, we can see this patient, Bruno, had a discharge from an emergency encounter where he had a fall. If I click into it, we can see what happened, what the admitting diagnosis was. That's HL7V2 ADT information, but also the documents that Zeus pulled based upon that ADT transmission. So in this case, we saw that from the fall. There was also an X-ray on the foot. We can also see some other information that was pulled, like the actual CDA, in this case, an encounter summary. We can see it in a number of different ways, such as the PDF if I want to. That gives you the context and the narrative of what actually happened clinically, not just a thin HL7V2 message. And this gives us a transitions work list to work through for our care navigators to identify which patients to actually reach out to and potentially move back into another care setting or to close the loop with their PCP. If I want to see more information on the patient, I can jump into the ZAP, the Zeus aggregate profile, which is the aggregation of all the data we pulled on that patient. And I can see other pieces of information that are useful, including the emergency and IP visits. In this case, there's the emergency room visit. From that source document, we parse out different sections that are useful for the actual care coordinator to decide what to do as a next best step.